Welcome to the Coming Home Well podcast, the show that educates, supports, and advocates for the veteran community. Your host, Dr. Tyler Perron, U.S. Army retired, will bring you exciting conversations with amazing guests about resources, research, and military history, all geared to helping our warriors to come home well. Here's your host, Dr. Tyler Perron.
Welcome back to Coming Home Well. I'm your host, Tyler Perron, and today we're going to be talking about something that, well, everybody kind of deals with at some point in their life, whether it's themselves or somebody else, and how in the world do you get the help that you need? And to help with sort of figuring that out, we have Kate Weaver with the National Alliance on Mental Illness, and I think I got that right. Did I get that right, Kate?
You got that right.
All right. I've been tongue-tying myself saying that for the last few days. But it's a huge problem of figuring out how do you get the help that you need. And Kate with NAMI, that's how I think of it as NAMI Num Num Num. It's a delicious organization. It helps people figure out and get the resources that they need. And so, Kate, thank you so much for joining us on Coming Home Well.
Well, I am delighted to be here. Thank you so much for having me.
So what is NAMI? Where are you? What do you do?
Great question. So the National Alliance on Mental Illness is the nation's oldest and largest grassroots nonprofit dedicated to supporting anyone affected by mental health issues. That could be yourself, as you mentioned, or someone you love. And a lot of our programming does support caregivers. So that's a really important facet for us. Mm-hmm. We are in 48 states. There's our state offices in 48 states, and then over 700 affiliates. And so I am the executive director for the Charlotte, North Carolina affiliate, which is the largest affiliate in our state. Many affiliates are just tiny little volunteer-run organizations, and then others are large, have big offices with lots of staff. So it can look very different in different communities, but our mission is simple but powerful. We want to support, we want to educate, we want to create awareness, and we want to connect people to resources. And everything we do is peer-led. So we train volunteers to go out into the community and do the programming. And everything we do is free.
Oh, free is good.
Free is good.
And so we are often focusing on veteran issues or first responders, but NAMI's for everybody, right?
NAMI is for everyone. Now, we do have specialized programming for veterans, because we know that population has a lot, they're more vulnerable in many ways. And so we do have programming, and we tend at our NAMI to, we're organically growing, supporting populations that need additional support.
That's a great way to put it, as, you know, because immigrants might need different things, or, take a population. One of the areas that we're often seeing new growth is in the first responder community, just simply because they're exposed to so much trauma, very similar to veterans, but it's often very different. Seeing and going and responding to people dying or being injured, or bad things happening.
Right.
And we would expect people to have a hard time, and for years people would be like, well, that's just part of the job, they're used to it. But we're finding out they're just like everybody else.
Well, and it's what I've learned since doing this work is there are industries that have higher than the national average suicide rates. The industry that I was not aware of, the highest rate of suicide is the construction industry.
Really?
Yes, really. And I think it's because, several factors. Of course, it's a very male-dominated industry, and men have a harder time seeking help for their mental health. It's high pressure. There are a lot of changes that happen. And I think people are not aware of the mental health support that they could receive. Those are probably just some reasons, but I'm not quite sure of all of them. But construction industry,
that's an unusual statistic. I hadn't heard that. I was literally talking with someone earlier today, and we were talking about doctors and how dentists have a very high rate, much more than most professions in the medical field, simply. And we're talking about some of the rationales. These are just, we're just lay people sort of talking about it. And it was like, well, that makes sense, because, you have insurance that covers all your other health care, and then dentists have to sort of figure it out. And it's a lot different model, and you have to be a business person in addition to being, a dentist.
Yeah,
And we were like,
absolutely.
oh, that's got to be really stressful if things aren't going well and things like that.
Exactly. So our organization, just to give you an example of how we kind of change with the times, our national organization does all the curriculum. And
Hmm.
so everything that we get as an affiliate has been researched and vetted, it's evidence-based. Well, we just rolled out a whole curriculum for the construction industry specifically. So now
Interesting.
we have trained volunteers who are going out into construction companies and doing
Hmm.
presentations to start the conversation around mental health and share ways that people in whatever company we talk to can get support.
So what does that programming look like? It could be in the construction field, could be in any other field. What is it when NAMI comes? What are they doing?
So this is under the umbrella of awareness. And we have, it's about an hour long presentation. And I would say it's a holistic mental wellness presentation. It covers everything from what's the difference between sadness and depression, all the
Hmm.
way to what do these medications mean? What are these diagnoses? And how do you take care of yourself? How do you
Hmm.
take care of someone you love? And what do you do in crisis? So if you're worried about self-harm or if someone you love is struggling, what are the steps that you need to take to keep both yourself and your loved ones safe? So we take that hour-long presentation and we tweak it to our audience. So we have a version for the workplace called
Hmm.
Stigma Free Workplace. We have a version for faith communities called Bridges to Hope. And we have a version for kids. And this, I think, is our most important program. It's called Ending the Silence. And it's geared toward middle and high school kids. We always have two volunteers go into the classroom. One does the main presentation, and the other presenter is a young adult who shares their story. One of the most powerful things NAMI does is storytelling. And we know that when we give someone the opportunity to share their story, they're giving permission to someone else to open up. So that really helps open up the conversation and takes the stigma away.
That it is so timely. We just had a young person in our community harm themselves. And
Mhm.
fortunately, they're going to live, but they are going to have a long road ahead of them
It's so
dealing
sad.
with the aftermath of the self-harm attempt. And it is so, I mean, it's so shocking to see kids, and we're talking kids, especially in like middle school and junior high, trying to harm themselves
Yeah,
for, what we as adults go, oh my, that'll pass, that'll be easy.
right.
But for them, it can be all consuming. And so to have the approaches where it's okay to talk, it's okay to get help, it's okay to, hey, this is normal to
Right.
be able to go get help.
Exactly. And we also, with our Ending the Silence, we have a version for parents, and we really focus on middle school parents because we want parents to know what signs and symptoms to look for.
Hmm.
All right, so this statistic keeps me up at night, but from onset of mental health issue to treatment, so how long does it take someone to get treatment?
Hmm.
On average, it takes someone 11 years.
Really?
It takes someone 11 years to get treatment. I think there
Wow.
are lots of reasons for this, but in the case we're talking about with kids, I think a lot of parents can be confused. Is this a teenage adolescent issue? Is it a mental health issue? And without understanding what signs and symptoms to look for and what type of help is available,
Hmm.
parents are often paralyzed. And I think that's one of the issues that we're trying to break down the stigma around.
That's a crazy statistic because I would think, especially with all the medication a lot of parents are pushing on their kids these days,
Yeah, true.
there might, but the kids that are probably suffering the most aren't the ones that they're taking to go get some treatment for this, that, or the other. It's probably the other extreme of the spectrum. But that's a
Exactly.
terrifying and fascinating area of study of that spectrum and that phenomena. So, NAMI does a bunch of things, and one of them are the resources, and the other is, hey, I know somebody or I need help.
Mhm.
I get in touch with NAMI. What does that look like? What is that? How does that work?
So across the country can look very different with different NAMI. So I'm just going to speak to Charlotte NAMI.
Hmm.
We identified access to care is one of the most challenging things people deal with when they're trying to navigate this very fractured mental health system. And so we thought, what if we can take that 11 years that it takes someone to find help and shrink it to 4 weeks? What if we
Hmm.
could do that? We are going to save lives. So we searched the country looking for any community that was helping mental health navigation for the community. And we found in Dallas, Texas, the Grant Halliburton Foundation had launched a mental health navigation system in 2019. We met with them. We said, will you share this technology with us? And they said, we would love to. And so it took us a full year. But last June, we launched the NAMI Navigator. And it's the first of its kind in the country. We are in discussions to rolling it out nationally. So it's really exciting that we can bring this tool to bear. But the way it works is it's 3 levels of care. So the first is a website. So it's NAMI Navigator Charlotte. And actually, any of your listeners can go to this website because there is over 350 pages of mental health information. What
Hmm.
is depression? What do I do if I have to call the police? What are some resources for parents, for teachers, etc.? That is available in English and importantly in Spanish. So you can access that information. Then, after you look at maybe learning about what might be going on with you, then you might decide, I'm ready to find a provider. And
Hmm.
instead of just Googling it, which is not effective, you use our search engine, which is you put in your age range, your zip code, and your diagnosis, and then you push go, and providers will populate. And those providers are taking new patients. They have been vetted by us and they have a lot of information available within the directory. And there are 11 additional filters. So you could say, I need a provider in this zip code that speaks Spanish, takes Medicaid, and is male, and focuses on OCD. So we want people to really be able to sift through the noise and find someone that's going to help them.
Yeah, there's a lot of facets that you have to include in that search, especially with mental health. It's not like, I need an ENT. Okay, here's your four. Uh, you know,
Exactly, exactly. And unfortunately, when someone is hospitalized for a mental health concern, oftentimes upon discharge, they're just given a piece of paper with resources.
hmm.
There's not, there's no personal touch, there's no personal, tweaking to make sure those resources are perfectly suited for that person. So, along with our website, we've also trained 35 volunteers who are navigators. And so anyone can call us during business hours, and a navigator will pick up the phone and ask questions, listen compassionately, and then we give those notes to our staff, and then we send that person an email with curated resources. So they are able to get that same, the search that they would have done on the website. Some people are too overwhelmed to look on the web.
And,
So our navigators help them through that. And then we just
that's a
open,
great point because a lot of times what I found is that people, when they're looking for resources, they wait until they're in crisis,
yes,
and then all of a
yes.
sudden they're trying to do all this research and trying to figure out the right answer, whatever the answer is for whatever their situation is, but they're in crisis, and so they're not really looking at the width and breadth of what might be the best thing for them. And you're in crisis. You're not, and it may not be full blown like, hey, you need to go immediately, but you're also not like doing it like the best way. So having those people there to
Mhm.
help you, and some people just aren't that great at the computer, or they're just like, hey, if I call this number, I'm gonna get help, and that's what NAMI's doing.
That's what we're doing. And so the other piece of the puzzle that we think is magical is 2 weeks after we give someone resources, we call them back. And
Mm.
so we say, hey, we gave you these resources. Did they pick up the phone? Are they taking new patients? Give us, were you able to get an appointment? And if they say
Hmm.
no, for whatever reason, we will provide additional resources. So our goal is to make sure someone gets connected to the right resource and takes advantage of that because at least in Charlotte, North Carolina, we are relatively resource rich, but it's the access that holds
Hmm.
people back from finding the right person.
Yeah, that access can be huge, especially with the various ways people pay for uh, doctors and especially
Right.
mental health care. It is so balkanized in many ways.
Yes, true.
And it's another whole different thing. We were talking earlier about dentists, and I'm like, yeah, it's a very similar kind of field. You know, some take this insurance, some take that, some don't take
Right.
any, some work with this organization or what have you. And it's especially if you're dealing with a mental health challenge, it can be a little overwhelming to figure out who
Absolutely.
do I talk to, where do I go. So
Yeah.
that's a really neat thing that NAMI does. So it's not just giving them a list. It's follow up. It's accountability. It's
Mm.
hey, do you take people off the list? If you put you give them a list and say, hey, Doctor So and So does this, and I called them and they said they weren't taking patients, or he doesn't specialize in that anymore, or fill in the blank.
Yes. So, yeah, so we have a couple different ways that we make sure that our list is accurate because that's the integrity of the whole program. If we
Mm-hmm.
can't be trustworthy, then we're nothing. So, number one, we ask providers to update their information once a quarter. And the benefit is the provider that is updated most recently goes to the top of the list when someone is
Mm.
searching. But additionally, that feedback loop we get from callers, if some, we just had this happen last month where someone said, I called this provider and they were really rude to me.
Oh
And so
wow.
we said, all right, we did an investigation and we ended up removing that provider from the list. If they're not taking new patients, we will take them off the public facing part of the website until they call
Mm-hmm.
us and say, we're taking new patients, because that's a huge barrier. If you
Is it
call three
really?
places and they say we can't see you for 6 months or we're not taking new patients, you're most likely going to give up, and we don't want people to give up.
Yeah, I mean, if you're not going to see somebody for 6 months, that might make sense for, like, I don't know, something physically minor wrong, a
Right.
specialty, but mental health, that's usually not a great answer.
I
Someone's
know, it's a
depressed
terrible
or,
answer.
suicidal. Well, we'll fit you in about 6, 8 months. How's that? Yeah,
Not going to
that
work.
sounds like a recipe for disaster. Yeah, that doesn't.
Exactly.
So what happens when someone calls? Obviously, we have the Navigator website, and we're put the link in the show notes, folks, and it's spreading nationally. It's going everywhere. But right now,
Hopefully. We're just starting. We're just starting.
eventually,
Yeah,
but down in
that's the
Charlotte, and
vision.
we're in Virginia here, and that there's a lot of crossover
Mhm.
as these areas spread. But as they start increasing it, but somebody calls, what does that look like? Is it just, hey, we're going to send you the email with the resources and follow up in a couple weeks, or is there some other magic that happens?
Well, I'm glad you asked that because it is magic. It's human connection. And we think that is the critical piece of what we're able to offer the community. Not only is it human connection, but it's people who've already been there in some
Hmm.
way. Most of our volunteers have a story, whether it's their own mental health journey or it's someone they love. But that empathetic listening is what we train our navigators in. And oftentimes, the callers just need to talk. They need to know
Hmm.
someone cares, someone's there to listen. Sometimes calls take 20 minutes, others take an hour and a half, and we are going to be there for them in either situation. And some callers call us back several times, and
Oh,
we're here
really?
for that too. Yeah.
So
And
you
then,
had mentioned you have the veteran program, yeah, and veteran programming.
mhm.
So what does that look like, and maybe get some feedback that you've gotten on that specific type of programming? We are coming home well. We focus on first responders and veterans, and I thought
Yeah.
I'd sort of focus in on that a little bit.
Sure. So, I mean, NAMI National, we recognize that veterans need additional support. So there is a class called Homefront, and anyone can take this class online. They can go to NAMI National or just Google your local affiliate, and it's an at your own pace class, and it's for families of veterans. So that's
I
one
love that.
resource. It's a great resource. Additionally, we have a support group for families of veterans, and it's virtual. We know
Hmm.
that oftentimes veterans and their families have a hard time leaving the house and going out into strange groups, whatever the case may be. So we tend to make those groups virtual. We're launching a veteran activity group this summer. And so we're working with a local veterans group. It's called Veterans Bridge. And we're doing more programming with them. And we're also training veterans to run a support group for veterans.
That's
So
really cool.
the way that works is you would come to me and say, hey, I'm a veteran and I want to have a support group. And I would say, that's fantastic. Let's find another volunteer and let's get both of you trained in the NAMI way, which we send you to a free training on Zoom. And then based on your schedule, we'll set up a support group. You might say to me, I really want this to be virtual. We'll be like, absolutely. You might say, Saturday at noon is the best time for me, and I live in this area. We'll make sure that we find a space in that area at Saturday at noon because we want our support groups to serve the community that,
Hmm.
like, I couldn't run a support group for veterans. We have LGBTQ plus groups, trans groups, women only, men only. We have a group for expectant mothers, young adults, neurodivergent individuals. So it's just growing as the community comes to us and says, hey, my population, my community needs help.
I love that because, there are specific needs for all these specific groups, and it's just a little tweak, in my view, a
Yeah.
different approach, different things, but people are people.
Yeah.
And, whether you're a veteran or neurodivergent or, it's just little tweaks to make things better and more comfortable. Yeah, but you had touched on something I think that's very important, and it's about the family members and the caregivers
Mhm.
and that's something I've noticed over the many years is that many times it's not the person with the challenge, whatever that is, as a veteran or someone seeking mental health, it's their family trying to find resources.
Mhm.
And that often adds a level of complexity because,
Yes.
they're not as necessarily 100% in tune. They just know someone I love and care about is having
Yeah.
a really hard time.
Right.
And, like, I don't know what's wrong with them. I know they need to see someone about
Right.
something, and this is the kind of things they're doing. And so if someone calls you and it's a mom, it's a brother, it's a spouse, it's a whatever, it's like,
Mhm.
hey, so and so has been doing this, and I know it, something's going on with them.
Mhm.
How do you know what kind of resources? Like, oh, you have OCD, you have this, you have that. They may not know because they've never been diagnosed. How
Right.
does NAMI help them navigate that?
Well, it's tricky because we do not diagnose people
Sure.
and we are simply sharing resources. I think in that case, we often tell people to start with their primary care physician.
Hmm.
That's a good place to get an initial diagnosis or at least a direction.
Hmm.
And then potentially go down a path toward a particular provider for your own mental health situation. But it can be different for different people. And some people, one of the things that I love about NAMI is we meet people where they are. Some people might say, there is no way I'm going to therapy. That's just not who I am. We're like, okay, that's totally cool. But maybe you'd be willing to come to a movie night with
Hmm.
other veterans. Maybe you'd be willing to, we do yoga at the resource center every once a month, or some lecture that we're hosting. And so
Hmm.
we try to bring people together around just connection without saying, all right, we're going to have to talk about all these deep mental health things. So,
Hmm.
so that would be one way we would help. But additionally, we have volunteers who are veterans, and that's where the expertise comes in. And this support group I'm talking about, imagine you're in a room with 30 other families that all are experiencing having their loved one come back and try to reintegrate into society. Well, that's where the wisdom is. Someone says,
Hmm.
my loved one is doing this. And the other person says, oh my gosh, that happened to me too. And this is how we manage through it. So, two things happen. Number one, the original person thinks, I'm not alone. This is not something I'm bearing by myself. And then also that resource sharing starts to happen. I think there's more wisdom in a support group than any one particular place in the mental health world.
Yeah, the finding your purpose and finding your tribe are often themes that we talk about, and
Hmm.
finding your tribe is often that the people
Hmm.
going through the things you're going through or have, or
Yeah.
it could be sometime in the distant, but you're, hey, yeah, this is how I dealt with that exact same thing. Uh,
Right.
and here's a resource, or here's an approach, or figure, there's different ways, but it's not just like, oh, that's new. I never heard of that. Of course not. People have gone through many things. So one
Exactly.
of the things I wanted to touch on was about confidentiality and career impact. First responders, whether they're fire department, first responder like cops, they're often very cautious about getting help, especially mental health
Yes.
care,
Mhm.
because there's their
Stigma.
career could be
Yeah,
ruined or
that's
the
right.
perceived ruined
Right.
because something's going on and they go get help. There are very few places that are like that nowadays, but there are still some.
Yeah.
It's, oh, he's depressed, can't work, got to take his gun, things like that. How does NAMI help with that? Is there any particular safeguards for confidentiality?
Well, when someone comes to our support groups, we don't ask for any information. I mean, they can give us their name if they want to, but they certainly don't have to. And the same goes for our virtual group. So, virtual group is a very safe place to start because you can just put your first name or a number. You don't have to put anything. So, I would say that would be one way that people can get support without divulging information. But I think what we do really well is we go out into the community. And so we work with our police department, for example, with a program called CIT. I don't know if you've ever heard of it. It's a national
I've
program
been
called
trained in it. Yes. Critical
Okay,
incident. Yes.
CIT.
Training. Yes.
So NAMI goes in and we are part of the CIT training with our police department. So the cadets are now understanding how to respond to crises that are mental health related, but they're also hearing what resources we have to offer. And so that we're trying to break down the stigma around seeking help in that
Hmm.
way.
Oh
If
no,
we're
it's
just,
a fantastic program.
yeah,
Yeah,
we love
it
we
was
love it.
one. No, I've done a lot of different things, but I won't ever forget that training because they're having you talk to somebody, and at the same time you're wearing headphones, and there's like three different voices talking in the headphones at the same time,
Yeah.
and overlapping, and it was demonstrating what it is to be like a schizophrenic.
Yes.
And so you're trying to deal with them, and it was a great training because you have a training police officer that's dealing with someone that's also trying to talk to them, but it's also hearing three and four different conversations in their headphones at the same time. And what an incredibly eye-opening experience that was because, like, oh, okay, yeah, they're hearing voices, but when you're a normal, healthy person and you're trying to focus on the person you're talking to, but at the same time, you've got all these, conflicting voices and noises going on. It really helps to have some empathy about what that person is going through as the person suffering from like schizophrenia and other very severe mental health issues. And so that's a wonderful training. So I'm glad you're involved with that. That's it's a, very, very good resource for the police officers, and a lot of places are making it mandatory. So have you ever had where somebody is working at a firefighter, first responder, whatever, and they want to get help, but they don't want anything to get back to their department, or, like if you're out there training and, hey, maybe, how do you deal with that? Or is
Well,
that something that really doesn't come up that often?
I would say we, like I said before, we meet people where they are. And
Hmm.
so if someone is seeking resources, we're going to help them and stay with them as long as they want us to. Everything is confidential that we do. And so we try to make sure that people understand that and their information is safe with us. But you know what? You build that trust over time. And
Hmm.
so we're relatively new, even though we've been in Charlotte for 30 years. It's just been within the last 2 years that we've grown significantly. And so getting that reputation of being the place that you can go for safe help and not have
Hmm.
that information leaked is part of what we're building. So,
So one of the questions, I guess, we were talking about the NAMI Navigator
mhm.
and being culturally competent in that specific area. Is there a facet that people can search for specific, cultural expertise? Obviously, you mentioned Spanish, but somebody who's a veteran or uh, you know, some other group. Is
Yes.
there specific facets on that? I hadn't had a chance to look through the criteria and the
There's
facet search.
all kinds of filters that someone can use. And if they don't see the filter they need, that's when they should call us too.
Hmm.
Because we actually were just now, last night, we had a board meeting and we just voted a new board member onto the team, and this person is a veteran. And that was a very deliberate search on our part because we want that veterans community represented. And we're also building out more resources for veterans on the Navigator. So all these things are in process, but as we get more involved and more we get more requests, we are trying to respond to those things. But yes, from a cultural competency, the language, the gender, um, obviously what treatment types the provider offers. So there's a lot of different ways to slice and dice trying to find help for somebody. Does that answer your question?
No, it does. That's exactly sort of what I'm getting at. Is that, a lot of people are unique needs and sort of slicing and dicing. So let's
Yeah.
talk about NAMI a little bit. It's not a flash in the pan. It's been around for a long time.
Mhm.
I think it was like early 1970s.
Yeah, very good researcher.
Yeah,
Yeah.
it was. I remember it was older than me, and so I was in 74, and so that was my touch point of
Okay.
okay, it's older than me, so it's been around.
Yes.
So, what is the background of NAMI? How did it get started? Obviously, in the 70s, it's been around for 50 something plus years,
Yeah.
and it wasn't online with the Navigator when it first
No, it was
started.
not. No, it was not surprisingly a couple of moms around a kitchen table who were really struggling to find support for their own kids. And so they
Hmm.
started this organization that it was started in Wisconsin and then it grew slowly over time to reach all the corners of our country. But it's a very powerful organization in terms of lobbying for mental health rights on the Hill. We have a big advocacy team. We're doing a lot of work with different communities like sports and different kinds of businesses and all different kinds of spaces that need support. So the national organization is very robust. As a matter of fact, we got a donation earlier this year from Mackenzie Scott.
Hmm.
I'm not exactly sure. I think it was $57 million that she
Yeah, the
donated to
richest woman in the world. You might have the former spouse of, I think it was the Amazon founder, and
Yes.
she is famous for her philanthropic
Yeah.
endeavors. 57 million. That's a lot of money for any nonprofit.
Mhm.
And was there a specific effort that she wanted them to focus on, or is it just, hey, do more of what you're doing?
I believe it's do more of what you're doing. I don't think there were strings attached to the funding. And of course, the organization is now figuring out what's the best way to deploy the funding across the
Yeah.
alliance because we're an alliance, we're all our own 501(c)(3) organizations.
Mm.
And our mission is to help our community. So it can look super different where I am in Charlotte versus somewhere in Oregon, for example.
Oh,
So
absolutely.
the most of the time, the national organization will put out, well, right now, actually, we're applying for a grant through the national organization on innovation, and our
Hmm.
navigator fits perfectly within that category. We're actually just launching a new a project that we're going to be adding an AI integrated component so it will have a natural language and search much faster for people.
Yeah,
So
that
that's
is
one
a
of the
lot
things.
easier.
Yeah,
Everybody
well,
loves AI right now,
listen,
and
it's here. It's
it's
here. And
here,
so
and you
I
got to use
believe
it.
we've got to embrace technology and utilize it responsibly, understand
Hmm.
it, but we cannot put blinders on. And so we're trying to figure out how it can make us more efficient. So we're looking for funding to do that.
No, I'm a huge fan, and
You
the
are?
natural language search. Oh yeah, the natural language capabilities, of large language models. Though I do teach, and I can tell I see a lot. I use AI quite a bit, and so when my students turn in things, I have a jaundiced eye because I can tell when all of a sudden things don't look like they normally do, and all of a sudden it's a little. There's telltale tales of when
There
AI,
are.
large language models are being used to answer questions, and I'm like. Well, let's talk about this. That
What do you
doesn't
teach?
computer science and information security.
Okay, so that makes sense that you would embrace
Yeah,
AI.
it's a professor. It's a university, and so I'm like, you guys know better.
Yeah.
I've had a few, they're like, yeah, let me redo that. That's my first thing is redo it. Let's,
Hmm.
especially when I'm used to what they write. That's crazy.
Exactly.
Like it's so
Come on,
different.
kids. Yeah.
Yeah. It's, come
We've been
on.
around a while.
We talk about it. It's a wonderful resource, but it's not a great resource for learning.
And
It's
it's not a great resource for therapy either. And I will
no.
make that point because there has been several tragedies that have happened because people are utilizing AI as a therapist. I
Hmm.
would say use AI all day if you're looking into what my symptoms might mean, or I want to find out more information, but not as a relationship that you would have with the therapist.
Yes, and yes, they are not designed for that. And yes, there's some telltale, and they will give you straight wrong facts and be very confident about it, and that's
Yeah.
a known problem. And so yes, that's
Yeah.
not a great. One day maybe there will be, but not yet.
We need
So
safeguards put in
right,
place,
or
and they're not
maybe a
there yet.
specific one. You don't want to use a general one for that kind of thing. But anyway, yes, I
Yeah.
could talk about that for an hour. But that's but yes,
It's
it's very
fascinating.
much going. So if somebody was looking and wanted to get in touch and said, hey, I need mental health, or I want to be a navigator, or I want to help the organization, whether they're in Charlotte or anywhere else, how would they get in touch?
Well, if anywhere in the country, they can go to NAMI.org, and there is a search where you can search for the affiliate closest to you. So that's an easy way to find out what services are nearby. If you want to get involved with NAMI Charlotte or find out more information about the Navigator or any of the services we offer, you can go to our website, which is namicharlotte.org, or you can just email us, which is just info@namicharlotte.org, and or you can call me.
So I'll put all the links in the show notes, folks. So if you're listening in your car, you don't have to like try to write it down or find the specific spot in the show, but it'll all be in the show notes with the links and everything. So don't worry about that. So, Kate, what are some of I always like to end on like a really good, personal story of something you've seen, some success story. Is there some one that stands out in your mind about, hey, this is why we're here. This is what we're doing, kind of emblematic of what we're trying to do.
So many. I have so many. Let me choose one.
That
Um,
is going to be the tough part. It usually is.
yeah, I think um, I think one that stands out to me was someone who called our navigator. She had lost her mother to suicide a few months before. She was in an abusive relationship and she had two children, but she wasn't able to work and she was very isolated. And she shared with our navigator that she was having thoughts of suicide, but didn't want to act on it because of her children. And so we were able to give her and she was also on Medicaid. So that's really tough because it's hard to find providers that take Medicaid. We were able to connect her to a provider right away, and we sent her to our support group. We have a support group for survivors of suicide loss,
Hmm.
and it's virtual. So we knew she could attend. And we called her back a couple weeks later, and she had done both of those things, and she was feeling better. And I believe, just she was so grateful. And then she came into the resource center because she wanted to beat the navigator. And so now we're building those connections and that ripple effect. Not only is that person feeling better, her kids are going to be healthier. And I mean, that kind of thing just makes me know we're doing the right thing.
No, that is exactly what I was looking for. Those, hey, yes, this is working.
Mhm.
Especially when you have those indicators, people that are around someone related to or people that commit suicide are at much higher risk of harming themselves.
Right.
And so that's at a very vulnerable point, was
Exactly.
reaching out. And that's an important caveat of, hey, that is exactly who you want to go and reach out and talk to at
Yeah,
that point. That's an
exactly.
amazing story. Yeah, those are great. I love those stories.
Oh, well, thank you for asking. I will tell you, let me tell you one more thing.
Sure.
I just read this article, I think it was in the New York Times last week, and there's been a study of the 988, which is the number you call when you're in a mental
Hmm.
health crisis instead of 911. Well, that launched in 2022. And across the country, different states have implemented it to varying degrees. Well,
Hmm.
this study showed that in states that had higher volumes of callers to this mental health support line, their suicide rate for young adults decreased. And it was significant. So the top 10 states with the most calls, their young adult suicide rate reduced 18% versus what
Yeah,
they
that's a very
expected.
significant drop.
It's a very significant crop. So we know that connecting people to even just talking to someone is going to impact the trajectory for so many young people.
It is, and that is one of the truest of any of the interventions is, hey, I care about you. I'm
Yeah,
talking to you. I'm there.
yeah,
Whether, however, wherever they reach out to. Very rare is it that, they're like, oh, well, I'm just going to do that final thing. It's that, oh, I made a connection because very few people actually want to die. They want the pain to stop.
right.
They don't want to die necessarily, but they
That's
want
so
that pain
true.
to stop or that chaos to stop. And
Right.
so the navigators being there where they can just call and talk and get
Yeah,
the resources, and especially for family members, you're dealing with things that you don't understand, and
right.
it's a very difficult challenge
Yeah,
to find that care often, just simply because there's so many different types and inpatient, outpatient,
yeah,
intensive outpatient, or just a provider that takes your insurance or however you're paying for it. And so,
right.
yeah, all those things are very challenging.
They're so and we get lots of calls. People have food insecurity. They're looking for
Hmm.
housing. They're looking for employment. And so we're becoming a little bit more of a jack of all trades. But the big thing is we are able to refer people to the right resource to get help in those different areas too.
We call those confounding factors.
They are confounding. They are very
Yes.
confounding.
Yes, and, like what is the real issue? And you've got all these
Right.
other things going on at the same time. So, Kate, we've talked about most everything about the organization, about NAMI, about everything, about the Navigator, which I hope goes nationwide very soon, and
Thank
that
you.
they give you that grant and it just goes everywhere, and people can just go search and figure it out, and have that boutique level of care, no matter where they are, of having those resources. Is there anything else we should know about NAMI and the resources in Charlotte?
Well, first of all, I love the fact that you've given me the opportunity to share this with your audience. So thank you. And I love the fact you used the word boutique because that's so true. We do try to make sure that we're helping people where they are in a very specific and gentle and caring way. What else would I say about NAMI? I think that um, the important thing to know is we meet people where they are. The entry point for care can be very different for different people, but we're there for all of those different entry points. And we are going to be here. And I think people, your listeners will know that no matter where they are in the country, there is a NAMI nearby and they should reach out if they're looking for help.
Folks, we've been talking with Kate Weaver, and she is the executive director of NAMI in Charlotte. There are NAMIs all over the country. She told me 48 states, but 700 plus
Yeah.
uh, elements across the country. It's pretty much everywhere.
Mhm.
If you live in maybe I don't know where the two states they aren't, but it's probably like North Dakota or something, middle of nowhere.
I don't either.
I got to figure that out. I didn't do that research, but it's pretty much everywhere, and they
Mhm.
do have specific veteran focused efforts.
Yes.
Not as much on the first responder, but it's the same concept as everybody. You need confidential care and references and information. They're there for you. It
Yeah.
is definitely something that's very important. Go get the help that you need. People are becoming much better and more aware of the resources, but also there's so much less stigma than there was 10, 20, 30 years ago, where it was a career killer. And now, in many cases, it's considered a very healthy activity to go get therapy and talk. And I see it all the time among the first responders and the cops that I know, where the first response is, boy, that guy needs therapy. We need to go get him a consult or something, even in the same department. So it's definitely has changed,
Mhm.
especially in the military. People are much more open to getting care than they ever were.
Yeah.
But there are still stigmas and there's still concerns, and people want to be superhuman, but they're not.
Right.
You do a superhuman job at the same time, you're still a person. So you need that care and support. Kate, thank you so much for joining us on Coming Home Well and sharing everything that NAMI is doing, and especially everything NAMI is doing down in Charlotte. And really thank you for spending the time with us and sharing. And I really hope the Navigator is everywhere all the time very soon.
Thank you. Well, this has been so much fun. Thank you for having me. And I wish you all the best and your audience too. And I'll leave you with, there is always hope. That's the NAMI way.
There always is. Thank you so much for joining us on Coming Home Well.
Thanks for joining us this week on Coming Home Well with Dr. Tyler Perron. If you enjoyed this episode and you'd like to help support the podcast, please share it with others, post about it on social media, or leave a rating and a review. Thanks again. And until all are home and all are well, this is Coming Home Well.